Sid McNulty. I'm a consultant physician in Wiston Hospital, and as well as being a physician, I'm also a diabetologist and endocrinologist. My background, I come from a place called Earlham, which kids around here may have heard of it, but it's in Salford. Not a very nice place. I went to a comprehensive. I was one of the more goodies of the comprehensive, in as much as I didn't have tattoos at the age of 15, etc. Then I went to the local sixth form college, and from there decided to do medicine. But yeah, I don't come from the kind of privileged background that you two sound like you're from. Yeah. I don't have a normal day. One of the things that I really like about the job is the fact that it's so varied. So my job consists of ward rounds, where I look at acutely unwell patients in hospital. I do clinics where I look at more longer term conditions like diabetes or endocrine problems. And then I do on-calls, but then outside of that I do a lot of non-clinical stuff. So I do a lot of teaching, I do some management stuff. Some doctors do some research, but I don't do much research. But I really don't have a typical day. It usually starts around 8 o'clock, usually finishes around 5, but not typical. Probably the variety. It's, you know, it is the fact that I'm doing something different all the time. I like the fact that it's a very social thing. I work in a hospital, so I work with lots and lots of people. And I actually like the fact that it's quite hard. I like the fact that it's quite challenging. I get a kind of mental workout every day. Some people find the job stressful because you're dealing with a lot of high stress situations. You're dealing with people that are unwell, people that are dying, people that are dying that you can't prevent dying, and then with that comes the relatives come in, and the relatives get distressed because we see this kind of thing every day, but the relatives don't. So you know, a lot of people think that the job's stressful. I think it's kind of challenging. It does occasionally get stressful if you get pulled in a lot of directions, but there's very little. For me, there's very little downsides to the job. I mean, I can go back to when I was a trainee doctor. We used to do on-calls, which would be all night, all weekend. You were in the hospital working. So in the past I've done an 80-hour shift. That's kind of changed now, as much as the trainee doctors now work shifts. So the most they'll ever work is a 12-hour shift. At the consultant level, because there's not enough consultants to be doing the shifts as it stands at the moment, we still do on-call. So I'll do, on an on-call day, I'll come in and I'll do my normal job from 8 till 5, and then at 5 o'clock I'll go home, and then from home I'm responsible for the patients in the hospital. So from 5 o'clock at night-ish to 9 o'clock the next morning-ish, I can be called any time. I usually get called, if I do get called, because something is serious. So it's outside of the normal comfort zone of the doctors on the unit. So I don't enjoy my own calls much, because I don't know, because you have to really think hard, and getting a call in the middle of the night, 3 o'clock in the morning, when you've had a broken sleep and then instantly needing to think hard is quite tough, and so that kind of interferes with my sleep pattern a little bit, but that's possibly the only downside to it. You do see lots of gory stuff, but you get used to it. Because you're seeing strange things every day. So because I see people dying every week, you get sort of toughened to it all, kind of, if that makes sense. It's not that you don't feel, and it's not that you don't understand that people may be suffering, but you're just kind of able to step back a little bit. One of the things which is quite cool is being able to glance at people and know what's going wrong with them. And this is what when we're teaching medical students, it's trying to teach them to be aware. So I can sit on a bus and go, oh, there's somebody with this and there's somebody with that, just really without thinking too hard about it. So that's pretty cool, I suppose. Okay, enthusiasm. I was almost going to say enthusiasm. You need to be enthusiastic because, as a general rule, it's a hard job and you're going to be working long at it. So if you're not enthusiastic about stuff, that will make the job drag. You probably need a reasonable degree of intelligence, but not as much as people think. You know, when you're studying medicine, it's a hard course, but it's not the hardest course in the world. There's just an awful lot to get through. Yeah. So enthusiasm, reasonable degree of intelligence, and probably, to be a doctor, a degree of dedication stroke obsession stroke OCD. So you need to look at the bigger picture, but then to execute a plan, you basically need an eye for detail as well. Well, as a consultant, one of the other things which I really like about my job is the fact that it's variable but it's flexible. So I work long hours, but a lot of the stuff that I do, I've chosen to do. So we're expected to do, I don't know, X amount of what's called direct care on patients, and then the rest of it we kind of write our own job description. So as you know, I'm into education. And I do education because I chose to do education, and some of the management stuff that I do, I did because I chose it. So I really like that. In terms of home time, is that what you're saying?
Yeah.
You know, there's a big thing about work-life balance. You've heard of this.
Yeah.
So work-life balance is, you know, making sure that you have plenty of quality time at home, rather than spending all your time at work. Now, because I enjoy my work so much, I don't feel the need to come home, shout at the kids, you know, drink alcohol and beat my wife up, etc. So I come home happy. So even though maybe I leave home fairly early on in the day, I get home at a reasonable time, and I get home in a great state of mind.
Yeah.
So I find work balance is absolutely fine. So some doctors kind of pursue private medicine, and that takes up your time. You know, so if I'm working for 48 hours a week for the NHS and I'm doing an extra 10 hours a week privately, that 10 hours a week would come out of my time with the family. So I don't do private work basically because of that. So no, I think work-life balance is fine. When you look at GPs, they often have a lot of time off during the day because they'll do a morning session and an evening session. But no, you work out, but you get home okay, and it's fine. My kids know who I am.
Yeah.
Okay. Yeah. In terms of weekends, so my weekend commitments is I do the medical admissions unit. So 1 in 7 weekends I work Saturday and Sunday, and I do a 9-hour shift on each of those days. About 4 weekends a week we're doing diabetes clinics. So the people that work 9 to 5 on a Monday to Friday, they can come into the diabetes centre on a Saturday and Sunday and meet us. So I work Saturday, Sunday mornings sometimes, and then I do the on-call. And the on-call is separate. I'm probably on call about 1 in 15, so a couple of days a month, and 3 weekends a year or something like that. I'm on call as well. Oh. But that said, because you're a professional, you don't clock in and clock out, and so I can be flexible about, if I need to get home early, I can sometimes get home early. And when we're working weekends now, we often get a compensatory day off the day after, because it's not good working 12 days on the run. You need a bit of time off. Okay, think about it carefully. Right, think about what the course is, and think about what the job is, and make sure you want to do it. When I was applying for medicine, I thought 5-year course, and the reason why I applied for it is I thought it looked interesting, and then I thought at the end of that I'm going to be a complete doctor who works 20 hours a week and plays golf for the rest of it and chases nurses. The reality of my sort of post-university life was I was working 80 hours a week. And then I was working 80 hours a week and being a father, and then I was working 80 hours a week being a father and studying for further exams. So it's a long, hard slog, but it's great. I've forgotten the question. What did you say?
What advice would you give?
What advice? Okay. Yeah. Okay. Well, think about it. Make sure it's the right course for you. Make sure you're applying to the right universities, because different universities do different courses. So some are doing problem-based learning courses and some are doing like classroom courses. And you've got to figure out whether or not you're a classroom kind of person or a problem-based, because a problem-based is very much you're on your own, you're an adult. Well, you're not on your own. You're an adult, and you've got to direct your own learning. So is it the right course for you? Is it the right university? Is it the right setup? Is it the right city? Yeah, and just get all that right.